I've been living in Japan for almost 7 years now, and I vote in Illinois, and I work in a research institute here as a researcher, doing research on health and nutrition, and I want to share my national health care story from Japan. About 2 years and 7 months ago, I gave birth to this little guy, not so little anymore, and in Japan, pregnancy isn't considered an illness, so health insurance doesn't actually cover it unless there are complications. But the whole birth, including 5 days stay with great food and everything, cost about $4,000. Unfortunately, though, afterwards I had a slight tear in my perineum, and I went to a couple doctors here in Japan and at some maternity hospitals, and they said that one of them, I won't name hospitals, but said that, oh, you look better than any of the women that give birth in our hospital here. No need to fix it. I'm like, oh, okay. But I was in incredible pain, and that was not what I was expecting following the birth of a child. So after 2.5 months, I decided to go back to the States, and I had health insurance in the U.S., so I thought, great, you know, I'll be covered. I had student health insurance. I was a graduate student in the U.S. at the time, and I went back. We searched on the web for somebody who specialized in pelvic floor disorders, and there are not very many places in the U.S. There's only about 5 to 10 locations that even treat such things. I'm so look at you. And I went and talked to them, and they said that they could do a minor surgery, 45 minutes, just sew me up a little bit. So the whole birth experience, 5 days staying in the clinic, was $4,000. A 45-minute surgery in the U.S. was $8,000, and my insurance paid $700 of it. The rest somehow was not covered. And then I needed physical therapy after that, which cost another $12,000, and the insurance didn't cover it. And I had no idea that it was going to cost anything like that. Yeah, you were very cheap coming out, but it was just the after effects here. So I think, you know, in retrospect, probably would have been better to search a little harder in Japan for somebody that could have sewed me up properly, but I had asked a couple doctors here. So I have kind of mixed feelings. The birth was great. We got to stay there together. Yuki and my partner and I stayed in the place for 5 days, and it was wonderful and very cheap, but I think one thing my experience points to is that women's health probably around the world is still kind of a low priority and not really done well in the U.S. I would say probably if I had not gone to one of the few places that specialized in this, I would have gotten fairly similar treatment probably, I think, talking to doctors in the States. But the problem of health insurance, I mean, we're still paying off those bills, and it's 2.5 years later. Yeah, you were so cheap coming out, but yeah. What do you see? Do you want to say anything? Are you glad to be here? No.